Good afternoon and evening, everyone. Depending where you are joining us from, we have Dr. Maria Pita from Brazil, who will be addressing the gaps in perinatal blood disorders. A brief introduction, Dr. Maria Pita is a pediatric oncologist. She oversees the medical residence program in the pediatric hematology department at the University of Campinas and in the Division of Hematology at the Samaritano Hospital, both in São Paulo, Brazil. Dr. Pita is the founder of the Pediatric Committee of the Brazilian Association of Hematology and Chemotherapy. He's also the fourth president of the Brazilian Congress of Pediatric Hematology, ABHH, and similar to pediatric oncology, he advocated for pediatric hematology to be a certificate program that is recognized by the Brazilian Medical Association and by the Federal Council of Medicine in Brazil. To achieve this laudable goal, she advanced a partnership with both pediatrics and hematology and made a joint venture between the Brazilian Association of Hematology and Chemotherapy and the Brazilian Association of Pediatrics. Join me to welcome Dr. Pita to the Latin America workshop, whereby she will be looking at the gaps in inherited blood disorders in this area and engaging yourself as participants on how we could really address these gaps. And I also saw Dr. Sandra Newton, who is a member of the Strategic Plan Working Group on this panel. She will also be addressing some of the strategic directions that we might take when it comes to Latin America during this session. So without taking much more time, Dr. Maria Pita, over to you.
Well, good afternoon, everybody. I would like to thank GANSID board for this invitation. And I'd like to say you that it's an honor for me to be here with you today, talking about access in hereditary blood disease in Latin America. Okay, first slide. Well, just a moment.
Yes. While Dr. Peter is trying to upload a slide, Dr. Sandra, maybe you want to say a few words.
Is it okay now? Hello, Sandra.
Yes. We just
nice to meet you,
we need you to have it in a slideshow. Can you put it in a slideshow? Thank you. All good. Good job.
Okay. So let's start talking about how to improve access to treatment people with hereditary blood disorders in Latin America. Okay. Okay, just a moment. Well, as Larry has already presented me for everybody, I have nothing to talk about in this slide. Well, here in Brazil, we have only 3 patient associations about only 3 diseases. Only 3 hereditary blood disorders. We will talk here about hemophilia, thalassemia, and sickle cell disease. Well, hemophilia has an incidence in Brazil about 1 to 5,000 to 10,000 men born alive, hemophilia A, and B, 1 to 30 to 40 men born alive. About 98% of both types cases affect men. Okay, ABRAFEN is the Brazilian Association of People with Hemophilia. And when a child is diagnosed with hemophilia here in Brazil, there is a mandatory registry of the patient in Ministry of Health to obtain the medications to obtain the factors. It's very important to to do this registry because it allows us to track people with hemophilia in national territory. So they have an automatic registry because to get the disease, to get the medication, they have to be registered. What doesn't occur with the other disease. This association is only assistance focused. They don't do education or other action, and they don't have, in fact, they don't have any problem with the patient or the medication. Well, about thalassemia. In 2022, we're registering 930 patients in Ministry of Health. Abrasta is the Brazilian Thalassemia Association. It was founded in 1982, and it's a non-profit organization too, and member of the Thalassemia International Federation, TIF, and their main jails are gently receive patients and relatives, orientate about their rights, provide information about the disease, supervise and evaluate the healthcare landscape in order to advocacy for equitable comprehensive care. Okay. Abrasta kindly present to us the main difficulties, the main problems that thalassemia patients face in our country. First, lack of blood for transfusion, especially for those with hair phenotypes. Limitations in accessing essential tests and imaging such as T2 MRI, ferritin and echocardiography, and etc. Difficulty in assessing combined education therapy and new therapies. Difficulty in accessing the spheroxamine infusion pump in Brazil. Lack of care coordination and comprehensive because of they have poor multidisciplinary team, a network of healthcare professionals without proper qualification, specific qualification, expertise in hematology for the care of thalassemia patients, poor physical infrastructure of public hemocenter and low public investment, and difficulty in accessing medical transportation services and food during transfusions. Well, let's talk about sickle cell disease in Brazil. It's estimated through the national screening that each year about 3,500 new cases of sickle cell disease are diagnosed in our country. Bahia has the highest incidence because we have one sickle cell patient born 1 to 650 patient born each year, and it's a very high incidence, but it's important to know that the neonatal screening is performed since 2001 only. So the assessment of incidence is a prospective one. We don't have all these patients registered. So we estimate that in Brazil, we have 60 to 100,000 people living with sickle cell disease. Neonatal screening in Brazil covers about 85% of the maternities, and only little peripheral areas don't do the test, don't test the children's. Well, despite numerous efforts and attempts, especially from the medical entity representing hematology in Brazil, such as ABHA, the Brazilian Association of Hematology, Hemotherapy, and Cellular Therapy, universities and hemocenters, with the purpose of mapping these patients and drawing in an epidemiological profile of them, we still don't have good accuracy in our data. This turns the management and follow-up of these patients a high challenge task. Well, the Brazilian Ministry of Health created about 6 years ago a computerized system for the registrations of patients with hemoglobinopathies such as SCD. It's called Hemovida. Because to know how many people we have with disease in a country is fundamental for the knowledge of care network, social demographic, and clinical data of these patients. For example, the Ministry of Health showed us that in 2021, we have only 24,000 patients registered. From the 140 hematology services, only about 40% contribute with this data. This percentage consists of institutions with a small, and the most important thing to say is that this percentage consists of institutions with the smaller number of patients. So HBA trying to do a partnership with the Ministry of Health to help them to call all the other 50% of the hematology center to register their patient because we understand that if you have exactly how many people how many patients you have, you be much more organized, and then you improve the quality of the treatment for these patients. So we think that it's very important to know how many patients are there, who are they, where are these patients. If you don't have if you have the registry of these patients, we can trace the epidemiological profile of Brazilian patients. You can develop adequate public policies. We can improve access to treatment and follow up. So we can improve their clinical evolution. And of course, you will have an improvement of the quality of life of these patients. So it's essential to consider these doubts. Who are our patients in Brazil? Where are they? How many are there? What does public health systems offers to them? What is the quality of the access to the structure that is offered? What's the quality of life of sickle cell disease patients? We have all these questions to answer. And it's important to know that when you talk about access, we basically refer to the structure of the services that monitor these patients, conditions of outpatient follow-up with the specialists, access to prophylactic antibiotic therapy, vaccines, clearing, state-of-the-art drugs, chemotherapy, manual and erythrocytopharesis, imaging tests such as transcranial Doppler, MRI, T2, catheters, state-of-the-art antibiotics, intensive care, multidisciplinary team, and bone marrow transplantation. And now, to draw this scenario, you have to consider two more relevant points. First, the government structure. The Brazilian Ministry of Health guarantees access to the item discussed in the first slide. However, only a small portion of the population receives them, excluding especially those who live in peripheral regions of the countries, far from large centers. Because of the poor register of these centers for the government, they don't exist. So they can receive hydroxyurea, chelating, good quality of chemotherapy, and all this kind of thing. They don't have specialists to take care of them. So the government here has a great a great work with the patients, but they don't access most of them. That's our real problem. Well, and besides of it, Brazil has a very high miscegenation degree with the prevalence of the Black race. And brownish, more Black, we are 57%, commonly being the low profile people, of course, based on our history. So we face a deeply ingrained structural racism in our society, which one of the great reasons that we can explain why there is this lack of attention given to sickle cell disease patient. We can't see today that even if we have so many people with sickle cell disease in our country, even the government doing the right things, we can't give it, we can offer it for most of them. Yeah. So sickle cell disease in Brazil deal with a very serious public health problem, and racism can explain all of them in case of the sickle cell disease. Well, and what do we think we can do to way out of this difficult landscape? First, development of a national registry of patients and ensure that all Brazilian hematology institutions adhere to it. Involvement of institutions of reference such as HBAH, SBTMO, the Brazilian Society of Cellular Therapy and Bone Marrow Transplantations, and seek support. And seek support from patients, associations, and government entities. Well, I will talk about my organization. It's a non-profit organization. It was idealized for me in 2012. And my organization is the only organization here who has, which has a doctor and other professionals in health area. And we try to do advocacy work, and that is based on education and awareness. Education, we do, I think we do in a high quality, we do this very well, because we try to give them a high quality information in the media, a good technical information to patients, caregivers, and all the professional in health area who are related to these patients. And we have been doing this through our digital media for about 2 years. And but we really think that now is the time to start with the other basic point, that is awareness, to bring empathy and support to these patients. Well, this month we will release a new campaign named Sangue do Meu Sangue, anemia falciforme, uma dor de todos. In English would be blood of my blood, sickle cell anemia, a pen shared by all, featuring celebrities from our country to talk about this important disease. Okay, artists, sports, people in sports area, etc., etc., communication area, etc. Well, through our social media, we post valuable and useful information, contributing to a high quality awareness of the population. Instagram posts 5 tips of sickle cell caregivers and patients. And for example, in this post, and we talk with our patients every day through this media, and they participate with us in all hematology congress. Next week we will have EMO, and we have a stand there, and we will be online with all the patients, bringing the most important doctors and specialists to talk with them about sickle cell disease. I'm very happy to talk with you. I'm very happy to talk with you today. I do think that it's important to talk about sickle cell disease, because if you don't talk about all this disease, thalassemias, hemophilia, and sickle cell disease, people in general won't be awareness of this disease. And when people is aware of this disease, they can include this disease in the society. And if you have an inclusion, of course, we will have improvement of the quality of life of these patients. We will have better clinical evolution, and they will have a better life. I thank you, everybody, for your attention. And we would have here today Caroline, a sickle cell disease patient, but unfortunately, she's out of the line. But I'm here to talk with you about everything you need. Oh, Caroline, are you here, Caroline? I can see you, my darling. Yes, you can talk with us.
Okay, wonderful. Thank you so much, Dr. Peter, for that breakdown of what is going on in Brazil. And with that number of patients, we definitely agree with you that the government needs to do more. But I think it's all in the power of the collective, right? Patient organizations, clinicians, government, when it also come together. And I think this is why GANSID is assisting to support the great work you're doing over there. So folks, if you have questions, we ask that you put them in the chat box or use the Q&A box to drop your questions. If you like to speak, you can also use the raise hand icon on the bottom of your screen. And there is also the show caption. If you prefer to listen to this discussion, maybe in Portuguese or another language, you can click the show caption and you see your preferred language and you can listen in that language. So thank you very much. Without wasting much time, I will call on Caroline Campinas, but before I do, I'd like to formally introduce Caroline. Caroline is a patient advocate that lives in Brazil. She's a communicator and marketing professional. And since 2018, she has been living with a new routine after an ischemic stroke. Even in the face of difficulties, she follows a routine that provides her with excellent quality of life, full of physical activities and without pain. Caroline understands the challenges faced by patients with sickle cell disease And today, she will be talking to us about the challenges, the gaps, and solutions to hereditary blood disorders in the Latin America. Welcome, Caroline.
Or good afternoon. It's a great pleasure to be with you today. And my name is Carol. I am right now uh, 29 years old. I completed this last weekend, 29 years old. And I am a communicator and marketing professional. And my routine, it's a specific routine because I don't feel pain. So I have more quality of life with this point. But uh, this doesn't mean that I don't have other complications. In 2018, I have a new routine with ischemic stroke. So I have to change my entire life and my career because of it. Even my difficulties, I follow a routine that provides with me a great quality of life. And right now, I had a personal trainer, also has sickle cell anemia, so he knows all the points that need to take my practice better and my life better. Uh, as far as my quality of life concerned, after taking continued hydroxyurea, I even felt pain about 10 years. But with this fact, even with this fact, I still suffer with some issues that have become more difficult. I get older, such as fatigue, infections, and recently I had COVID-19. So I is still getting better about this crisis with COVID-19. I know my case is an exception in Brazil in terms of access in my country and quality of life and the access of medicines and doctors who getting me better. And with that, I use my profession to communicate to the people around me and in my other place, our people with my life, people around me, they know what is sickle cell anemia. And especially because despite a number of patients, it is not a well-known disease in our country. The people don't know what is sickle cell anemia. And with this, I make my career about talking about sickle cell. Today, I talk to with patients in my hospital at Campinas so that I explain of us to getting better with quality of life and not also waiting for a transplant.
Have you finished, Caroline?
Yes,
I thank you a lot with your talk. And Caroline, uh, we know, we can understand that you are in a university here from Campinas, and Boldrini is like a sickle cell disease center, and we have all the best therapies. You receive all the best therapy that we have about sickle cell disease. You have a great chemotherapy system there. We receive all the medications. You have specialists, etc., etc. What do you feel about other people living in Brazil with sickle cell disease in the media's um, in the social medias, digital medias? What do you heard from them? What they talk about, what they don't like, they don't have?
The adult patients usually talk to me about the pain and how the pain exclude them about all of things that a normal person can do. So I feel in the social media they talk about the pain and then this transplant. Everyone wants the transplant because the pain make them feel they are lost in her lives. So I heard about the patients in the Boldrini Central who still feel pains and how mm, how
They
they
deal
don't
with.
how they don't want to use morphine for the rest of their lives, and how can how how can make
Do
better
different. Yeah.
is how can
Uh,
mm, how
in Boldrini, talk about, tell them that Boldrini is a special center. I was the responsible, the coordinator of the hematology patient there. I did my medical residence there, and in the last few years, they have trying to offer to the patients alternative therapies, like I don't know, the like music therapy, Reiki, acupuncture, etc., etc. Do you think, Caroline, it really improve the quality of life of these patients, or you think it doesn't make the difference?
oh do a lot of difference right now. Both the adult patients of Boldrini receive special care. uh, Even with these treatments, these new treatments, we have a new hematologist who talk with adults, and the way who we can talk with our works and our families about this new phase in our lives. We growing up there, so they know us since I'm in my case my 2 years old, so we can speak with them like a family too. And these new points in our treatment make us better like a human, because in other hospitals we know we don't have this special care, this special look about us, with love, with affection, with family too. So this make our the difference in our treatment like adults, and with the new patients has come, and the babies of the patients who has born here, born there, so we can have like a big family in there.
Very important, I think, because all these patients that are today adults were my little children 20 years ago. And these transitions from pediatric to adults is a problem all over the world, I think. Sandra, you were here, you can talk about it. And Boldrini has this characteristic. Unfortunately, Boldrini is the only one sickle cell disease center. They have about 1,500 patients there, pediatric patients that are becoming adult patients, and they have different needs, but they don't want to go to the university to be treated like adults, exactly because they don't have the same look. They won't be included. They are afraid of be free. Can you imagine what people, what how the pediatric patients feel in the rest of the country. Totally different, because here in Brazil, the patients who are 18 years old, they are they are they receive they don't do part of the of that department. They have to go to an adult hospital, and in this gap we lose all these patients because they have to go to hematology centers. We have only the universities ones and a few in the public institutions. So they go to the emergency rooms only in crisis, can have an outpatient clinic to receive them. And that's my fight here with Red Moon, Lua Vermelha Association, for we to have care centers specific for sickle cell disease patients. Because they really need it, because their quality of life here is terrible and very sad. So
we have a large number of patients who have become pregnant in Campinas. So the approach has to change because the patients want to have families and live a life close of the normal as possible. So we
yes,
start to see a lot of patients with our age and who didn't have the same chances in the life and that we had, and this important care from the family and from the hospital was extremely important in our lives.
yes, we had live in our association with a gynecologist, Dr. Dr. Maria Paula, who is specialized in gynecologist and obstetrician in sickle cell disease patients. She has an outpatient clinic just to receive these patients, but she's the only one who talks about gynecology with this patient, and and her father is the responsible is the responsible doctor, is the chief, the head of hematology in Campinas University. So it's the only one outpatient clinic. When we did the live, many patients participated, about 50 patients participated all over the country, asking basic questions. It was very interesting, and at the same time, it was very sad, because they don't have any kind of specialist to treat them, to be with them. That's why we had to have at least one sickle cell disease center with all the specialists specialized in sickle cell disease, neurologists, orthopedists, etc., etc. That's it. Any questions? I don't think they.
Actually, there are questions for us from the participants. Thank you so much, Caroline, for your amazing presentation of what it is to live with sickle cell disease and what is really needed to improve the quality of life of people that are living with sickle cell disease in Brazil. And I'm sure this also represents many of the other Latin American countries. So thank you so much for that presentation. So I'm going to look in the Q&A box. There are few questions there. A question is, somebody asked the question, Dr. Peter, they would like to know how partnership with multinational companies could help to resolve some of the issues, the challenges that are faced in Brazil. So partnership with, it could be pharmaceuticals, it could be not pharmaceuticals, but the multinational companies. If you think about partnership at that level, how that could be of help? Thank you.
Well, in fact, with this campaign, this marketing campaign, when we, in which we are bringing the celebrities, doing this awareness campaign, we really think, we really hope to bring partnership, not only in the pharma, but in other areas, to do exactly what? To help us to make this dream come true. We have to have our care center, and we know that the government won't do this for us, for our patient. So I think I will have to have private sectors, private area and financials, yes, to help us to do it. That's why I really think, and I'm hoping that it will happen. I would like to invite everybody of the Sickle Cell Association como que é compartilhar mesmo? To share our media campaign, because we have to have general people knowing that there is a disease which is called sickle cell disease, and these patients needs to be seen. Okay.
Thank you, Dr. Peter. I have a question for you myself. So I'm wondering if what you think about utilizing the power of the collective, bringing organizations from hemophilia, thalassemia with your sickle cell group together to work on, even if it's one common advocacy issue to improve, the current status of things. Because I'll give you an example. In Canada here, Thalassemia Foundation of Canada and the Sickle Cell Awareness Group of Ontario, we did a lot of work together. We go to the government together. For instance, we raised the awareness among the policymakers by asking the government to recognize June 19 as World Sickle Cell Day. We use that to raise awareness. And then we have June 19 for World Sickle Cell Day and May 8th for Thalassemia Day. So that way we raised awareness with the government first, and everybody in the parliament now know, okay, there is sickle cell, there is thalassemia. So we did that together as a collective, and then we went back because our doctors, our patients are seen by the same hematologist. We went back and then we are asking for resources for the clinic together. So it is multiple voices coming together, not just sickle cell by itself, but bringing thalassemia and sickle cell together. We are able to even, be more successful in advocacy. I'm wondering, what do you think of a similar strategy in Brazil, whereby maybe you can start with something small that doesn't ask for money, asking them to recognize, the government to recognize, the United Nations, June 19th as World Sickle Cell Day, and May 8th, for instance, for thalassemia, and I think it's April for hemophilia. I think if we do that, maybe we'll raise more awareness, and then there would be better empathy from the government perspective, because I know you said I have to go to private and other companies, government won't do it. But I think sometimes if we raise adequate awareness with them, it might be a different story. And I'm just sharing this to say, this is how we did it in Canada, for them to listen to us, right? Because what I find, if you present a bill in your parliament, Dr. Peter, if you present a bill in your parliament, the parliamentarians have to debate. They have to debate the bill. In the course of debating the bill, they would then have to learn about the disease. When they learn about the disease, then they have more empathy. They see how people suffer. But if we just go to them and say, give us money, they might say, well, we need money for this, for that. You're not the only one that needs money. But if we show them, right, and ask for something first that don't require money, you might be surprised when you go back to ask for money, they will be more willing to give. So again, GANSID will be happy to work with you and your country in advancing advocacy with governments, because that is the way to go. It's great to work with multinational companies. It's great to work with the industry, but the government has to also do its part. It is a I would say, is a multi-pronged approach that we have to use. It's not just one way, but we have to use different approaches. And I really think we have to consider, advocacy, but first by raising awareness with the policymakers. What do you think of that?
Well, Larry, it's a very good question. And you know what? I'm very focused in sickle cell disease. Only sickle cell disease, and sickle cell disease. And when we started GANSID work, I have to say you that unfortunately, I kept focused in sickle cell disease. After I received the invitation to talk about the other associations, I could understand that, yes, we have another associations, only more two, but I didn't have time to talk with them. That's the real thing. And the third thing, we got in touch with Brasta 1 week before the Congress, and with hemophilia 1 week before the Congress. And I was happy and surprised to know that they were very interested to be with us. They want to make part of it. And we know that hemophilia doesn't have lots of problems here, but thalassemia has. And I thought that they didn't have this kind of problem like blood, like chemotherapy. In sickle cell disease, we have a schedule for sickle cell people, but thalassemia, we have only 1,000 patients with thalassemia in a continental dimension country. So they are no one. Let me ask you, do you know how many people with thalassemia you have in Canada?
Oh yeah, they don't have a registry, so it's not accurate, but I would say perhaps about 3,500 to 4,000 people live with thalassemia in Canada. And sickle cell is about 6,500.
Yeah, lots of people. Because one patient with the disease is an important, even if you have one, it's important.
Yes.
So from now on, after this Congress, I have next week we have the EMO Congress here. I will be there to talk about sickle cell disease again, and I will get in touch with more time with these two presidents, because we will invite them to come with us, because yes, it's important to have more people asking for the same thing, especially in chemotherapy area, because you know it's the great problem. Yes, I only thought about it I only started to think in other disease with this meeting. It was very, very important to talk with the president, because I think we will have a very, very good very, very good response from them. And I think in the next Congress of GANSID, next year, we will be able to present you a new country, or at least a new something done for these patients. I do hope so. I do hope you can do it.
Thank you.
You for the question.
I think we can do it. I think it's important to work together. There is power in the collective. And I think sometimes when we go to the government, it's not just one disease, it's a lot of disease. They feel like they're spending less money for more people. It makes sense. So let's look at commonality of purpose. What is it that we can all benefit from? Suppose, and you know, sometimes I think even like I know you and I have spoken, and you have mentioned resources is a big issue, you know, in the clinics, right? So if you need resources for sickle cell like staffing, I'm sure for thalassemia you need as well. So going to the government with the same need to benefit multiple diseases, I think will be more well received than going individually. So we can work as a collective and achieve. I think Dr. Newton is here as well. I don't know if you have any comment, any question. I know
yes,
Dr. Newton is part of the strategic plan working group. They are trying to put together the strategic plan for the organization. So she's listening, she's taking notes, but you might have a question, one or two or so, either Caroline or Dr. Peter. Thank you.
Sure. Well, thank you for the opportunity. And it just, is there an echo? Okay. I just wanted to just say thank you first to Dr. Pita and to Caroline for just these compelling accounts, just the scope of the concern in your country, both from a patient perspective and from a practitioner one. And one of my interests as part of the strategic group that as Landry just mentioned, and just as part of some other sessions that are coming in this Congress, is thinking about that patient and self-advocacy effort. And I wonder, maybe a question for both of you, how organized in a large territory like this one are patient advocacy efforts? Are there networks that are growing? Is that a challenge to get people to come together, to have that voice, right? As users of the healthcare system, to feel that there's an opportunity to have an impact. I just listening to some of the things Caroline highlighted, you know, changes around needs of pregnant people in your area, people wanting to think about, you know, how to increase their quality of life across the lifespan. How are patients able to have their voice heard with those who will direct funds, plan programs, things like that? I wonder if you might both like to answer that question. I appreciate your answer.
Hi, it's a pleasure to, and at this moment in Brazil, the use of social medias, it's the most the most important use to talk with a lot of people. So using the social media to make conversation doing and make the people know about the disease, and it's in my point of view, it's the way to impact more people.
So I hear there that it is the online presence versus gathering in person, because maybe of the size of your country, right? Practically speaking. So Caroline, if I could follow your answer, do you have a local chapter, or are you as connected with people in your area as on the other side of the country through social media?
with social media, we can talk about people in other side of the country and the people who is in our hospital too. So at the same time, we have a lot of point of views and a lot of realities with the people who doesn't have the medicine when he needs and the people who has support of the hospital. So we know about the all these realities and can put this in a plan and talk about our experience, talk about the support of our family, and talk about the new things that other hospital is doing with me and can use in the other hospital with other patients. We can have this change this little change with these conversations in social media and with the entire country. I have friends in Bahia. It's a stage far from my stage, so I can talk with people from there, people from Rio de Janeiro, people from states who has more code than the same every day. So we can try, we can change this little um, this little change can make our routine better with a lot of realities. I can think with most of realities of this country and make a big conversation. So
Thank you for that. And I wonder, Dr. Pita, do you have comments about what you've observed about patients working together and their ability to influence and connect with government and funders about the care of sickle cell patients and other blood disorders?
Well, Sandra, nice to hear from you. And it's a pleasure to be here with you. And I will tell you that it's not a very easy way.
No.
You know what? Sickle cell disease patients here are Black people and low profile class. I would tell you that 95% of these patients are in the public health. That's the first problem. Do we have access from the media? Yes, we have. But the problem is to call attention of these people. When we started Lua Vermelha digital media to talk about it, we understood that there are lots of WhatsApp groups in Brazil, and they talk with them. They talk in these groups for everything. Even the poor, the patients from the peripheral areas that ask for patients from São Paulo, from Rio de Janeiro, Bahia, etc. What are you doing? Do you receive hydroxyurea? Do you receive blood transfusion, etc.? Like they are a clinic, and with wrong answers, of course. So we are trying to bring these people from the WhatsApp groups to receive good technical information, news. We have to most them the real and the best information you can give them, because we have a team of professionals with us. We have a doctor, nurse, psychologist, etc., etc. But we still don't have a lot of patients with us. For example, Lua Vermelha, the Red Moon organization, have only about 5,000 people with us. It's a little it's a few patients, but they are with us every day. They are talking with us, etc., and we want to spend it. But to spend it, we have to count with the general population. Larry talked about it. We have to show the population, but we have to make them understand what the disease is. With our campaign, the artists, the celebrity, we did a little video and explaining what is the disease. They have to understand that's anemia. You know what? We even chanted. We are not talking with sickle cell disease. We had to because everybody knows sickle cell anemia. And for this campaign, we are using sickle cell anemia, and then talk about all the problems with the pain crisis, etc. But artists are will talk with these people. They will stop and listen. Oh, etc. Oh, etc. Oh, she they are talking about our disease. And many people who have sickle cell disease that don't want to talk, they have sickle cell disease because it's a stigmatized disease. And here in Brazil, we have lots of white people with blue eyes, etc., with sickle cell disease because we are very, very miscegenated people. We have, como é que fala índio mesmo? We have indigenous people with sickle cell disease, lots of them. In last year in Bahia, they discovered a group, I don't know the word in Portuguese, a colombola group, only with African people with lots of sickle cell disease patients. We have to do something. So that's my idea. I don't know if it will work, but I think we have to call attention of everybody. There is a disease. It's called sickle cell disease. This is a disease. This is a chronic disease, incapacitating disease with high level of mortality, and we have to take care of these patients. It's a very difficult way. It's not an easy way. I've been doing it for 11 years. And I do hope that this time with this campaign, we can open the mind of all these people. The Farm Novaris helped us with this group. My brother that have a publicity agency are helping us, and I do hope we will have a good result with this campaign.
Fantastic.
I count on you. And I think I count on GANSID to help us to do it and to tell the world that we have diseases like thalassemia, hemophilia, black van Diemen anemia, etc. You have to do this work. Yeah.
Wonderful. I wonder if Ms. Flannery has a question. I wonder, just as a quick follow-up, if there is time, I see Brazil as that hub. Who are your regional partners? Again, thinking about the power of the collective, what are other countries, regions also doing this work, maybe more isolation than not, that need to be brought together as well as we think about the ways to make this region's needs better represented and needs met. So what are those other countries where there is also a collective of people with sickle cell and other types of blood disorders that need to work together? So when you look to your region, north, south, east, west.
Yes, the quality is the most important tool for us to be together. Yes, you're right.
Yeah, I was just thinking about, do you look to, the western part of South America? Do you look to your immediate region north-south, like what is your closest sort of group also working hard on this that
Yeah.
could come together? Yeah, don't
Yeah.
know if you have a thought there. All right. I wonder, Caroline, you've been listening very intently. Did you have anything, reflections further about what Dr. Pita shared?
Ela tá perguntando para mim?
Caroline?
Caroline. Caroline.
There
Caroline.
she is. I don't know if you had
Dr.
further reflections. I always have questions for you. If you do not have a reflection on what Dr. Pita shared, one of my thoughts is, how could we make the transition piece? This is a very big area of study, transition from childhood pediatric care to adult. Seems like that's where you lose a number of people, I'm hearing, in terms of just being able to see them regularly. What was your experience, Caroline? Is there something we could do differently to retain adult patients? What do you think?
I think it's totally different because of the responsibility we have in our lives. Because at the child patients, our job is just go to school and have fun. So when we getting adults, we have to work, we have to support our families too, we have to getting better to our place we study or we work together. So it's more responsibility for a patient. So I think this is getting us more anxious patients. With the pandemic, for example, we getting a lot of anxious about how can I live right now? How can I getting better for me? And I have to support my family who has to getting better too, because it's a problem, work problem. So we have a more I forgot the word.
Okay, use your word.
Have
Use your word.
more worries to think.
Yes. Mhm.
So I think this getting our treatment more than to treatment the pain. It's to treatment our mind, to treatment our lives, to getting better with my relationship and getting better with everything. So getting adult, we think more things than we have to conciliate
Words.
all these things, and this getting more pain of us,
Mhm.
real pain and mind pain. So this turn more difficult to treatment adults because we don't speak about all these things. We more things we get out. Oh, this is my problem, so I get in with this, and I will don't speak with anyone because of this. So we have to treatment more than the pain with adult patients.
That's well said. Well said. Thank you. And both of you have alerted me to something important too, about the way that there are different strategies potentially for reaching the Indigenous person living with, right, sickle cell, the person who looks visibly white, the person who identifies as Black. Do you see that different strategies for reaching different patients, or is that not established right now? What do you think?
At this moment, in our country, it's the same way to treatment for everyone. And at the hospitals, if the hospitals has more curious about your case, you will be a different treatment. So we had a difficult with the hospitals because they don't have. So I really will study your case and do a job with this. So they just took your medication of pain and go away, and tomorrow we think about the other patients who came of us with the pain. We don't have a treatment design to think about our individuals.
The equity piece could be developed better. That's what I hear. Thank you, Caroline. And what were you going to say, Dr. Pizza?
Well, what she's thinking about is about the outpatient clinic, is about a group of multi-professionals taking care of these patients. It besides the disease, we have the human being. It's not good for the mother, the father, the parents to go to the hospital, to the emergency room, and each time she goes is a different doctor, a different nurse, and she has to start everything again. And most of the time when she says, my little child has a sickle cell disease, most of the doctors, most of the general pediatric team doesn't know, don't have expertise to deal with those children, those people, and they try not to go to the emergency room. When they go, they are treated, especially the adults, of course, like additions, etc., etc., etc. And I think that what Caroline is saying that is that when we see, and we doctors sometimes do it, when we see the patient, most of the time, because lots of points, different points, we see the disease. No, know the patient. I think because of our day-by-day routine, etc., we don't have time to see the patient. We see the disease, and they are not seen. But if you have a care center specialized in sickle cell disease, it will change, or at least it will be easier to deal with it. They will be facing us, think about everything. The psychologists will be with us, the teachers will be with us, the physiotherapy, and we will see the person, not the disease. Yeah, I think it's important.
Great note. Thank you both. Those are wonderful comments. I'm looking to see whether there are other questions in our chat. Do not see them. I think that you've covered so many things, and I'm hearing what you're asking for as well. Partnership was one of the questions that you covered. Partnership with multinational companies could help. And then you and we talked just more recently about patient networks and the power of those. And then you just made some very compelling comments about, the patient-centered care and some of the equity issues that travel with sickle cell and other inherited blood disorders, and needing a system that looks at the whole person. And I know Caroline has said a few times, quality of life, life is longer. How do we make it also a good life? So I'm grateful for those comments. I wonder if Ms. Andre has other comments for us. I don't see other questions at the moment.
No, I
I'll
don't.
keep looking. Yeah.
I do not have any more comments. And the poll, we still have the poll put up. Dr. Newton, did you? Oh, Amos, can you please start the poll for us? So I know the panelists cannot do the poll. For those who are participating, if you want to complete the poll, kindly do so at this point. Amos, can you kindly start that poll for us? Thank you.
Yep, I just launched it now.
Thank you very much.
A poll.
And we want to thank you again, Dr. Peters, Caroline, for the great insight. Definitely, the situation in Brazil is not unique. It's the same everywhere. And this is where I think coming together to resolve this situation will be very important. And also the awareness program you're doing, like the celebrity awareness, I think that will really bring a lot of visibility to the disease. So thank you for all the great work you're doing. And if there is no more Yeah, so if there's no more comments, we can call it a day, and we see everybody tomorrow at 5 o'clock Eastern time. Thank you very much.
I would like to thank you all for the opportunity. I'm very happy to be here, and I know that next year we will be able to present different results from Brazil, Latin America, United States, etc. Thank you.
Thank you so much. Thank you, everyone.